So I'm going to demonstrate how to do a modified notch test today. We have EDTA whole blood here. We're going to use 1 ml of this. And a large centrifuge tube here. And they have the notes on here, so we'll just need a couple of these pipettes for that. So there's your 1 ml of blood. Then we're going to put 9 mLs of formalin. You guys want to wear gloves. Keep this open with a large pipette. We're going to fill this up to the 10. And now we have the 10 mLs total. We're going to mix this gently. So that's all mixed up. I'm going to take it to the centrifuge. And we are going to be at 1500 RPMs. And we've got it balanced with another balance over here. So that's at 1500. We're going to spin it for 5 minutes. And I've also got a timer here. Okay, so it's done spinning now. So we are going to pour this off and leave the pellet at the bottom. You can see there's you probably can't see, but there's a little pellet down here at the bottom. So we're going to pour off everything but that. Usually let it kind of drain. Your pellet's still down there. And we're going to take a drop of methylene blue. Mix that. Put a drop on there. Put a cover slip on that. And we are going to look at this under the microscope here. You're first going to evaluate it on the 100 magnification and then go back over it on the 400. You should use the fine focus in and out through your fields, just so you see all of the planes. Alright, looks like this one's all clear, so no microfilaria. I'm going to demonstrate how to do a centrifugal fecal. We have a zinc sulfate solution that we mix with our feces. So you want a cup, about 5 grams of feces. Mix it well with about 10 mLs of zinc sulfate solution. After that is mixed, you're going to take another cup with a strainer. We're just using a gauze here. Pour this sample through it. And then that sample will go into a tube to be centrifuged. We have our balance here of the same amount. And this will be centrifuged at 1500 RPMs for 5 minutes. While that is being centrifuged, I'll go ahead and do the direct smear. You're just going to take an applicator stick and get a small amount of feces to just coat the stick. One drop of saline. And then you just want to mix it on the slide until it is very mixed in one layer. The direct smear is the least diagnostic of the fecal methods. The centrifuged method seems to be one of the better options to pick up most of the ova. A simple flotation is not as precise. There's the direct smear. We can go ahead and look at that under the microscope. So once your centrifuge stops, you can go ahead and open it, take your sample out. We're going to fill the rest of it up to a meniscus with new zinc sulfate solution, easily, not to disturb everything that's at the bottom. Place a cover slip on the top and read that in 10 minutes. The next type of fecal flotation would be the simple flotation, and then you would just need 2 to 5 grams of feces. We're going to go ahead and mix that with our zinc sulfate solution. You want enough to fill the tube that you will be floating it with. You're going to mix that very well. And once that's mixed, you can go ahead and strain it through a gauze. Take your test tube, fill it to the top, and you can top it off to where it has a meniscus. And then we will set this with the cover slip on it for 10 to 20 minutes, and then you can read it. I'm going to demonstrate how to do a fecal sedimentation. You would do this fecal test if you were looking for fluke eggs or any kind of parasite eggs that are large and won't float for a normal flotation. You start out with the same amount of feces. We have 2 to 5 grams in this cup right here. We're going to mix that with 30 mLs of just plain water. We're gonna mix that well. And then once that's mixed, you get a large tube and you strain this through a gauze or a strainer. And then as that's draining, you want to go ahead and fill up the rest of the tube with some more water. So now that our tube is filled to the top, we're going to let this sit for 15 to 30 minutes undisturbed, and then we'll come back and repeat. So this has done sitting for 30 minutes. So we're going to go ahead and pour off the supernatant and then resuspend that pellet in some more water. Sit for 30 more minutes and then repeat that again. So now that that is decanted off, we'll go ahead and put some more water in here. And we'll let this sit for another 30 minutes and do the same thing. So after we have decanted the supernatant off the pellet 3 times total, it's time to read the sample on the slide at this point. So we'll go ahead and get our slide ready. We're going to decant the supernatant off without disturbing the pellet. So now that we just have the pellet at the bottom, we can go ahead and take a sample of that, put it on a slide with a cover slip, examine that microscopically at 100 times magnification. Continue to do that with each drop of sediment we have here until all of it is gone, and then record your answers. So for urine collection and urinalysis and cultures, there are multiple ways that you can obtain the urine sample. One would be a free catch urine sample, just literally catching the sample as the patient urinates is the least kind of diagnostic, less sterile procedure that you can use. You want to do a first catch of the morning so it can be concentrated. You also want to get the sample midstream, so in case some bacteria that is like in the end of the urethral comes out first, you want to discard that and get like a midstream catch. This would tell you more about like the specific gravity and if there is red blood cells in there. It does seem to pick up more white blood cells just from contamination. The next way would be manual expression of the bladder. This also can lead to false positive for bacteria and white blood cells, and that one also is not used for cultures and things. And the best way to get a urine sample would be a cystocentesis. This is where you go in sterilely with a needle straight into the bladder and then extract urine. For this procedure, you would need to have the dog lie in lateral recumbency or dorsal recumbency. You can either use an ultrasound guided aspirate, locate the bladder and keep it between your hands and just use it that way, and then go in with the needle, or use a blind stick. The cystocentesis is the most sterile way. So I'm going to demonstrate how to do a free catch urine sample on this patient of ours. This is a first morning catch here, so it is concentrated. So if we walk her, we're going to try to get a midstream catch. So the first void is, we're going to let that go so it doesn't have any residual bacteria from her urinary tract. So after we get the free catch urine sample, you can go ahead and draw it up in a syringe. This urine sample is nice and concentrated since it was a first morning catch. It's concentrated overnight. It is a little bit cloudy, but it's pretty clear. You can see through it. There's not a lot of debris going on, so this is a very good sample to run. So I'm going to demonstrate how to do an ultrasound guided cystocentesis urine sample. I'm going to put some alcohol on her belly here. Find her bladder. And then you can use a 1 inch or 1.5 inch needle. Her bladder is large enough where we don't need the 1.5 inch. We're going to go straight in dorsocaudally. Get your sample let up on the plunger so you're not pulling out contaminants. Pull straight out. And this is pretty dilute. She's been having some incontinence issues. So whenever we transfer this to a urine tube, we're going to take the needle off, change the needle, so we're not transferring any kind of bacteria from the needle to the tube. So I'm about to demonstrate how to do a urinary catheterization of a male dog. So there's a polypropylene urinary catheters. Those are the little plastic ones that we usually use for like blocked tomcats. They're stiffer, a little more irritating, so you'd want to use those if you're trying to get a blockage out of the urethra. Then you have the red rubber catheters that are obviously red and rubber. They're softer, more pliable, easy to do for like a male dog that you're just getting a urine sample on, a quick procedure. And there's Foley catheters that you can use. They have a balloon on the tip of them, so if you're going to use for an extended period of time, you would want to use one of those because you can blow the balloon up and keep it in place for extended periods of time. You don't have to worry about it coming out every time they go to the bathroom or every time they move around. Today we're going to use the red rubber because it's going to be a quick procedure. Okay, we're going to be demonstrating how to do a urinary catheterization on a male dog. We have Arlo here. So I'm going to go ahead and clean the tip of his penis. We have our sterile lube. And that's about how much will go in. draw back a couple mLs and then discard that. We want to discard the first few mLs for contaminants just going through the distal part of his urethra. And then this sample here we can use for urinalysis and culture.
Stay on.
And that's it. So I'm going to demonstrate how to do an ear cytology. We are going to get a sample from each ear, some of the symptoms that would alert you to needing an ear cytology. Would be if they're shaking their head or scratching at their ears, if they're red or irritated. You do want to get a sample from both ears, even if one ear seems to be only affected. So we're going to go ahead and do this. On the right ear, you just want to go down in, get a couple little swabs. I know. Get your sample. The left ear. And for the left, we're going to go ahead and break that so we know that this is left and this is right. You want to do 2 slides for each ear, one with a drop of mineral oil, and then one for staining. So for the left ear, we'll do the stained one first, and you just want to roll this. Don't smear it, but roll it down the slide. And then same thing on your right. I'm gonna let these air dry. So after your slides have air dried, you're gonna go ahead and stain them so you can look at them under the microscope. So the samples with the mineral oil, you're not gonna stain those. You just put a cover slip on those and look at those microscopically. But we're gonna demonstrate the stained sample so we can look for yeast and bacteria. So we have 3 stains here. In the first stain, we're gonna do 8 slow dips, about 2 seconds each, in and out 8 times. And then in the next 2, we're gonna do 6 slow dips. You always do want to have different sets of stains for ear cytologies, skin cytologies, things on the outside of the body, and then another set for hematology samples as well. So you're just not mixing all of the yeast and bacteria that are going to come off on these ear cytologies with your aspirates and things like that. Okay, we're going to let that drain there. And then we will do our left the same way. 8 dips in the first one, and then 6 in the last 2. After you rinse and air dry your samples that are stained and labeled right and left, you can go ahead and look at those under the microscope. We're going to start with the right ear. You want to focus it first and then move up to the oil magnification. You can go ahead and put a drop of oil on your slide. And then slide over onto the oil magnification. Go ahead and read the slide. It looks like the right ear has few yeast. And then we'll go ahead and look at the left ear as well, doing the same procedure. And he has occasional yeast in the left ear as well. Okay, for skin scraping, if you're looking for mites, there are two different types. You can do a deep scrape, which you're looking for mites that live in tunnels or in hair follicles like Demodex and scabies. Then the other type is just a superficial scrape, where you're just scraping the area and getting like skin particles and hair particles, looking for superficial mites. We're gonna do a superficial scrape of this dog's tail. She has some hair loss and crusting here. So we're just going to scrape superficially to get some skin cells and some hair here. We're gonna put that on a drop of mineral oil on a slide. I know, rude, huh? If they have multiple areas that are affected on the skin, then you want to get a sample from each area. And then we will put a cover slip on this and look at it under the microscope. So after you get your sample, we have our slide here that has some hair and skin particles. We're going to put a microscope slide cover on the top, and then we are going to examine this microscopically on 4D magnification. You want to use the fine focus in and out through the planes, so you can look through all of your fields, scan it for mites or mite eggs. And it doesn't look like there's anything abnormal on this patient.